This meeting is being recorded.
I welcome you to today's webinar on erase pigmentation spots and freezing away skin lesions. We have the opportunity to talk to Gail Verspelt from the manufacturer H&O. So please take the opportunity to ask your questions directly to her. Just speak during the presentation, open your microphone, and maybe you switch on your camera because we are in a small group and it's open to everyone. So I'd like to give the word over to Gail to start with.
Thank you very much, Jacqueline, for the introduction. So my name is Gail. I'm representing the company H&O Equipment with the device Cryopen. Lasermet is our distributor in Switzerland, and today I will give you more information about our technology and about our devices. So we are based in Belgium, and we have a second office in the United States. In Belgium, we are doing the manufacturing, and we work globally with distributors in more than 60 countries. And in the United States, we sell directly through the practitioners, directly to the doctors. In our company, we work with roughly 40 employees to make sure that we can serve and help everyone in our best possible way. To start with, I will present you a video. And in this video, we will show you the intended use about Cryopen. So in this video, we will show you which lesions that you can treat with our technology. So the intended use or the range is really wide. You can treat a lot with Cryopen, from skin tags to warts, hemangioma, sunspots, pigment spots, and much more. So everything which is benign. Then we have the benign lesions on the body. So erythematosis, leishmaniasis, H-spots, keratosis, solar lentigo, rosacea, and much more. Then we have the lesions on the foot. So for sure in your practice, you will meet people with HPV lesions or warts. So the warts can be treated successfully with our device. So we have the flat warts, vulgar warts, filiform warts. Maybe at this point you are using another technology, but with a Cryopen, with a micro technology, we will work only on the lesion. And as a last step, we have all the OBGN lesions, so the anogenital lesions, the condyloma. So with this video, I wanted to show you first already the intended use, but if you have the device in your possession, you will have the manual available, and all these lesions are mentioned in our manual. Please keep in mind that our device is a medical device class 2A, so these lesions can be treated. In the next slide, we present you that we have different partnerships. One of those partnerships is a partnership with Professor Delmar Mol. She is professor and head of dermatology in the Erasmus Hospital in Brussels, in Belgium. And with her, we are doing a lot of cases, a lot of, let's say, a lot of treatments to show you how precise and how effective the device is working. So in the next slide, I will show you a video to see the precision about a Cryopen device. So here you can see, to start with, the treatment on the eyes. So even on the eyes, you can do treatments. I always recommend, once you start using the device, start with the device for easy lesions. And in the next stage, you can work around the eye area. But as you can see, because of the micro applicators, we work so precise that we will work only on the lesion, not on the healthy tissue. For the patient, there are many advantages, so no anesthesia is required. Here you can see some before and after pictures. Donc ici, vous voyez quelques photos avant et après. And in these pictures, which is important, in some cases you can see a patient whereas one session is sufficient, but in other cases 2 or 3 sessions will be necessary. That is depending on the age and on the type of the lesion. But as you can see, even darker skin we can treat. So because of the microtechnology, we work only on the lesion. Some people join the call a little later. For them, it's important that we just started presenting the technology.
But was it in real time? Huh?
So
it's really short. It's a short.
The time is, let's say, to freeze a lesion, it's only a matter of seconds. Depending on the size of the lesion and the depth of the lesion, you need to choose the correct time. For example, the lesion which you saw now on the face, the solar lentigo, that will take a few seconds, 10 or 15 seconds. But when we are talking about a wart is in a lot of cases 40, 45 seconds, depending on the depth.
Okay.
Here you can see treatment on the legs. So effectively, it's a treatment who works in a matter of seconds because of the microtechnology, because we work immediately on the lesion. Now we will present a treatment on the lips. In fact, 2 treatments on the lips. And the last one is really interesting. So let's say the intended use of the device is really wide. You can treat on the face, on the body, on the foot, everywhere you can treat all benign skin lesions.
Isn't it douloureux?
Au niveau du douloureux, and in terms of pain, the patient will have no pain. Why? Because we work so precise only on the lesion. Once the patient is indicating pain, then it means that we are touching the healthy tissue. And in that case, you need to stop freezing. So this is an example, another example on the lips. After this video, you will see the before and after pictures. But it was a lesion which had a darker color. And after 3 sessions, it's completely disappeared. So another freezing cycle. And now here you can see the pictures before and after first session, second session, and third session. Once again, the results are really effective. In a lot of cases, 1 session is sufficient when we are talking about superficial lesions. In other cases, a second or a third treatment will be necessary. In the next slide, we explain you the advantages of cryosurgery. And cryosurgery is the controlled destruction of unwanted cells by extreme precise application of extreme cold. So we will work always on the same temperature. We will work always minus 89 degrees because we work with the nitrous oxide N2O. There are many advantages for your patients: no anesthesia, no pain, less problems with scars and depigmentation. It is the standard to treat all benign skin lesions, HPV lesions, and keratosis. And the intended use is mentioned here. So it is dedicated to treat all the following benign skin lesions: acrocordon, actinikeratosis and cheilitis, hemangioma, leishmaniasis, discoid lupus erythematosus, all type of warts and anogenital warts, rosacea, lichen sclerosis, granuloma annulare, molluscum, seborrheic keratosis, and viral lesions. So let's say with the Cryopen, you can treat a lot, which is really nice and which can be a really added value in your practice. In terms of devices, LaserMed has different devices in their portfolio because now, even in this call, we have different people. We have some general practitioners, we have some gynecologists, we have some, let's say, some differences. Depending on your specialty, LaserMed will recommend you the correct device. But the purpose, each device is having the similar effect. With each device, you can treat all benign skin lesions. Depending on your device, you always have different microapplicators. And it's important, if you will treat a patient with a lesion, you should choose for the correct applicator. So depending on the size of the lesion, you need to choose for the correct applicator. All the applicators are mentioned here. And to give you an idea, if I would have a lesion around my eye area, a really small or tiny lesion, then you can choose for the smallest applicator, the blue-red applicator. And with one gas cartridge, with one 16-gram cartridge, you can treat between 230 and 270 seconds. That means, imagine if you will do a treatment today and another treatment just in 1 week, you will have no loss of gas. You can store your device just in his box and you can use it after a few days. Always use it until your gas is finished, until it's empty, and then you can reload. Is everything clear regarding the different applicators for all of you? Véronique, ça c'est assez clair pour vous, pour les gens qui parlent français? Est-ce que les applicateurs sont assez clairs?
Oui,
Oui,
yes,
super.
I already had a look in the manual and I saw
Super.
that we need
Wonderful.
different.
Wonderful. Maybe
yes.
something important to add, imagine if you will treat HPV lesions. In that case, it's important that you clean all your applicators, and you can clean them in the autoclave, or you can clean them with alcohol, with disinfection. So LaserMed will share both protocols with the people who have an interest in the device. In the next slide, we explain you the penetration rate. So each 5 seconds, we go 1 millimeter in depth. And this is really important because depending on the size on the lesion, this is the step-by-step clinical application. So in a first step, we will estimate the size and the depth of the lesion. Then as a second step, we will choose for the correct applicator. So once again, depending on the size of the lesion. This protocol is really easy. It's just 10 steps to follow. Once we have chosen the correct applicator, you can start freezing. And here you can see, depending on the depth of the lesion, we will freeze for enough seconds. So imagine that I would have a wart with a depth of 3 millimeters. In that case, you need to freeze for roughly 15 seconds twice. Determine the movement. So in the next video, I will present you the movement of the device. We will start freezing a little bit further from the lesion, so the patient feels the first cold effect, and now we will freeze the lesion. As you can see, because of the micro applicators, because of the micro technology, we stay only on the lesion. We will not touch the healthy tissue. So this is the first freezing cycle. Afterwards, it's important to wait and to let the area thaw. So stop freezing when the patient indicates start of burning or pain, because in that case, we are touching the healthy tissue. So now we have the thawing effect for about 30 seconds. And always wait until it's fully thawed. And now we will do the second freezing cycle. The second freezing cycle is necessary to achieve a successful cryo or cell necrosis. And that's it. After 10 days, you can schedule a follow-up treatment. Imagine if the lesion is not completely disappeared, you can repeat the treatment once again. In the next video, we will explain you how you need to load and hold the device. This video is really important. It's really easy. So you have the device and you have the cartridges. In each device, in each set, you will find a tweezer and the manual. The manual is really helpful tool because it explains correctly and exactly the intended use of the device. Now we will open the device. We will open an applicator as well. And we will place this with the pin upwards in the device. Always make sure that the opener is in the device with the pin upwards. If not, it will not puncture your cartridge. So now we will place the cartridge in it. Always make sure that you hold the device tip pointed downwards, and then we will close the device. So again, it's really easy to use it. You just need to use the applicator, the cartridge correctly, and then your device is ready for use. Now we will remove the protection cap, and now you will see that the gas flow is there, is present. So once again, you can use your device until the gas is finished. Imagine that you want to discharge. You can remove the applicator to release the gas.
You have better to put it off before you with the gas.
Yes, because once the gas is finished, you will have still some air in the gas cartridge, so you can release the air and the gas, and then you can replace the cartridge.
Okay.
It's always easier. Then you can remove the cartridge, and then it's ready again to charge it again. On the right side in this presentation, in this slide, you can see the position of the opener, which is really important. So always place the opener with the pin upwards. And here you can see the position of the device. The device should be used in an angle between 45 and 90 degrees.
C'est logique.
So here again, we explain you the intended use. So the intended use of the device is really wide. All the lesions which are mentioned here can be treated. If you have any doubt, all these lesions are mentioned in the manual as well, but please stick with the treatment of benign skin lesions.
Can you also treat scars with it?
No, so the Cryopen is not effective to treat scars. It's only effective to treat all benign skin lesions, HPV lesions, and all lesions which are mentioned here. In the next slide, I will show you the different techniques, how you can use a device. So we have 4 different methods. And depending on the type of the lesion, you need to choose for the correct application method. So this is in case of a solar lentigo, a superficial lesion. So always go close enough to make sure that your lesion will freeze. Now we will go to the second step. This is an example in case of a treatment for a wart. So when you will need to do a wart treatment, we always recommend first to cut the dead skin, and afterwards you can start freezing. So always make sure that you go close enough. Now we will go to the third method. This is an example in case of a hemangioma, for example, which is a smaller lesion. So here in this case, you can choose for the smaller applicator, and you will assess the lesion and you will start freezing. So point to the lesion and freeze. And to end the 4 methods, we have a last method. And this is a really interesting case. It's in case when a lesion is not thick on the skin, for example, for a fibroma. We will freeze first the base and afterwards the lesion itself. And now we will freeze the lesion. So I hope that those 4 different techniques are clear for all of you. It's really easy. So depending on the nature of the lesion, you need to choose for the correct technique. In the next video, we will explain you the principle of cryosurgery. And here you will see that we will reach the cell necrosis minus 27 degrees. This will produce the cell necrosis. So here you will see that we start freezing the lesion for the first time. You will see what happens under the skin. So we have the intracellular ice which is formed. So this is the freezing effect. As you can see, you will have still some red shards. So that is the reason that we need to organize the second freeze to make sure that the lesion will be completely disappeared. This is the thawing effect, the osmotic shock. And now we will go to the second freeze. So this is the complete protocol, how the freezing cycle works. In this presentation, in this slide, you can see a lot of pictures before and after, but I will show you now another video to see the correct position of the device and the results. So here again, you can see that in the first stage, we will assess the lesion. We will point to the lesion and start freezing. So as you can see with the microapplicators, we deliver precision. And we work only on the lesion, not on the healthy tissue. Here you can see some results before and after. And as you can see, the results are really effective. And really a beautiful cosmetic result as well. So in between the treatment, once the freezing cycles are done, what will happen? The lesion will blister and crust, and after a few days, the skin will renew and the lesion will disappear. In the next slide, you can see some pictures more before and after, some examples in terms of warts and OBGYN lesions. And as you can see, these results are also really positive and really beautiful. In the next slide, we explain you the protocol. So the protocol is the protocol which we explain in the video. 10 easy steps. So as a first step, assess the skin type and the width or the depth of the lesion. Choose for the correct applicator. In a third step, we will determine the treatment time. We will determine afterwards the movement. Pre-freeze to let the patient feel the cold. Point to the lesion and freeze. Let the area thaw and repeat freezing the lesion a second time. Dry the area and schedule a follow-up visit after 10 days. Here I've added in this presentation an example of a return on investment, because I have a lot of questions of doctors who are asking, okay, but how fast do I have an ROI? So it's important to know with one cartridge that you can treat more than 200 seconds. That means that it's roughly 4 till 6 treatments or lesions per cartridge. If you treat between 4 and 6 treatments, the treatment cost is €3.65. And imagine if you will organize each week 5 treatments for approximately €50, then your return is each year more than €10,000. Of course, in Swiss, in some areas, the treatment price will be higher, but this is an example to show you how quick the return on investment on the Cryopen is. So we have different devices, and here it's important to know that LaserMed will reach out with all of you to make sure that all the devices can be explained, and depending on your specialty, LaserMed will recommend you the correct device, and you will have different applicators available. Next to the applicators, we have as well the cartridges. So your device is working with cartridges. Once the cartridges are in the device, your device is ready for use. And on each device, we deliver 5 years of warranty and 2 years on the applicator. Of course, LaserMed is there for you to help you and to train you even more and further into detail. This is today a first introduction from us, from the manufacturer point of view and from LaserMed. Feel free to ask your questions on this point if you have certain questions. Is there someone who has a question, please? I see that some people are still muted. Feel free to unmute and to ask your question. But please keep in mind that the quality of the device is really high, so you can use the device easily for 10 years. The warranty is 5 years, 2 years on the applicator. So we really trust in the device, and we also trust in LaserMed, which is already a long time our partner in Swiss. Jacqueline, maybe you want to add something?
No, I just want to point out that you can find all the different models on our online shop, lasermed.ch. And if we can help you choosing the right device, just contact us. And we will find a solution, of course. And I think I will send all of you the link to this shop, that you can easily find it. So if no one has a question, still
just one little question.
Yes?
Is it possible to get your presentation?
Jacqueline will share all details with you, okay?
Yes, no problem.
Thank you so much. Thank you everyone for joining this session. It was wonderful meeting you. I hope that you learned something today and that you saw let's say, the range of Cryopen and our advantages of our device. And I hope that LaserMed can help you further in the near future. So thank you very much. Have a wonderful day.
Thank you from my side, and I wish you a pleasant day. Thank you, Gail. It was a pleasure having you.
Thank you so much, Jacqueline. Take
Thank
care.
you. Bye-bye.
Bye-bye.